told to get mammograms starting at age 40 to prevent breast cancer, but there are more tools for identifying women at risk for breast cancer that often aren't being used. The founder and CEO of Ms. Medicine, Dr. Lisa Larkin, knows this firsthand because she is a survivor. And Dr. Larkin's with us once again this morning. So good to have you back in the studio.
Thank you. So good to be here.
So, Lisa, do you mind sharing why your breast cancer wasn't detected as early as maybe it could have been because of a mammogram?
Well, right. So, young women in their 40s are often healthy and not really worried about very many illnesses and are told to get their annual mammogram. And mammograms are a vital component of our war against breast cancer because early detection matters. But we've learned a lot about specific risk factors for breast cancer, and one of them is really breast density. And that's something that more and more women are becoming aware of. But there are models to help women actually identify whether or not their risk is above that average risk of the population or below the risk of the average population or equal to the risk of the average population. And many women don't know that, and really women aren't getting this called risk assessment done. And so, even for me, had I known that my risk was as elevated based on breast density, I could have done more.
You may have done more than mammogram because the mammogram didn't see it at first. Is that what happened?
Correct.
So help us to understand why these tools and what they are in helping women to know their risk to better prevent breast cancer.
Right. So there are widely available and multiple tools. They're called risk assessment calculators, and they're all a little bit different. They all take into consideration well-established risk factors for breast cancer, including multi-generational family history, your biometrics, your weight, your height, your BMI, your reproductive factors, and then breast density. And so it can help women give you, like we do for heart disease, a 5-year, 10-year lifetime estimated risk of breast cancer. And if your risk is elevated based on specific guidelines, we can do more to screen you more aggressively. We can talk about medication to potentially lower risk. But where I really see the emphasis is on, again, even having conversations about the importance of lifestyle at lowering risk.
Yeah, what are some of the lifestyle factors that can contribute to breast cancer?
So I think everybody's aware, we talk about lowering your cholesterol and heart disease prevention with diet and exercise, but that is equally important for breast cancer. In fact, we believe with appropriate weight management, a healthy diet, exercise, and limitation of alcohol, that in the United States we could prevent 30% of breast cancer. That's a huge number, 70,000 cases of breast cancer, and women are not really aware that they can do something to prevent their risk. Women know about diabetes prevention and heart disease prevention. We haven't really had enough of a conversation about what they can do to lower their own risk of getting breast cancer.
Yeah, and so you say it kind of needs to be treated like maybe cardiovascular risk. Well, how can women talk to their doctors about what more than mammograms can I do? What risk assessments can I do? Like how can we talk to our doctors?
Right. I mean, I think bringing up the conversation, one of the problems with healthcare delivery models right now is that, again, young, healthy people don't see the doctor very much. And there's very few points of contact. And so when they do see the doctor, it's typically a problem-focused visit. The visits are very short, and family history to identify people who would benefit from genetic testing, or even to identify women who have elevated breast density and are at substantially increased risk, get missed. And so one of the things that I'm really passionate about is empowering women to go in with tools to say to their doctor, I saw in my mammogram that my breast density is elevated, and I had a grandmother that had breast cancer. My mom's fine, but I'm worried about breast cancer. Can you help me understand my risk? And these tools are available, and clinicians should be using them.
All right, Dr. Lisa Larkin, thank you for that great information.
Thank you.